afternoon, ma'am.
Good afternoon.
I am Vishal Mutekar, second year medical student of the Medical School Foundation, and I am here for the comprehensive history taking of the infant. So, there are few steps in this examination. Like I will ask about the identifying data, then history of present illness, then like what made you to seek for the consultation, then child history, like prenatal care, then all the history related to the nutrition, feeding and all. And then I will proceed with the family history, then personal and social history. And at the last, I will check the review of system. So, is it okay if I start with the examination?
Yeah.
First, we will sanitize our hands for this examination. So, whatever the information you will give, it will be kept confidential. So, is it okay if I start the examination?
Yeah.
Okay. Can you tell me the name of the baby?
John.
John. What is the age?
23 days old.
23 years old. Okay. Can you tell me the sex of the baby?
Male.
Male. Okay. Can you tell me the religion?
Christian.
Christian. Can you tell me the address? Where do you live?
I'm living in Kasarisa.
Okay. Possible. The house. Okay. Can you tell me about like what made you to seek for the consultation today?
Routine checkup.
Routine checkup after the birth. Okay. Next will be the history of present illness. Can you tell me, have you noticed any abnormalities like skin rashes, lesions, or any sign of jaundice to your baby? You didn't.
I haven't observed.
You didn't notice. Okay. We will proceed. If you didn't notice, we will proceed with the neonatal history, like birth history and all. First, I will check for the prenatal care. When you started going to the clinic for the neonatal check, when you got to know the clinic, okay. How many visits you had in the 8 visits you did? And while in the pregnancy state, do you used to smoke?
No.
Do you used to drink?
No.
Or have you gone exposed to any radiations or anything?
No.
No? Okay. So that means it's good. So now we'll go with the birth history. Can you tell me about the birth history? Like, does the baby is delivered to the normal vaginal delivery or cesarean?
Vaginal delivery.
Vaginal delivery. Can you tell me about the labor? Like, for how much long it was there? 2 hours. Okay. Can you tell me, like, does any complications were there at the time of delivery?
No complications.
No complications. And when you got discharged from the hospital?
After 2 days.
After 2 days. Okay. Means there are no abnormalities at the time of the birth. We will go with the birth history. After the birth history, we will go with the neonatal care. Can you tell me the what was the weight of the baby?
3.5 kg.
3.5 kgs. Does he had any complications?
No complications.
Does the baby is actively moving?
Yeah, he's actively
moving.
and respond to the activities.
Respond to the activities. Do you find any abnormal movement or involuntary movements?
No, I won't find any.
You didn't find any. Okay. So we'll proceed with the feeding and nutrition.
Yeah.
Can you tell me how the baby was breastfed? Formula feed or
It's breastfeeding.
breastfeeding? Can you tell me who did the breastfeeding? You or any caretaker?
No, me only.
You only. Can you tell me how many times you did the breastfeeding in a day?
8 times a day, after 2 hours. Yeah.
8 times a day after 2 hours. In the birth history, I forgot to ask what is the age, like when he delivered? Birth of death.
21st May 2020.
2020. Okay. And then you told me about the this thing, breastfeeding. You are doing every 2 to 3 hours breastfeeding. Do you find any complications like abnormal, like baby can't able to swallow the milk or latching problems?
No, I won't see.
You didn't notice any problems. So we'll proceed with the immunizations. Can you tell me what kind of vaccines was given to a baby?
After birth, BCG vaccine and
BCG?
Hepatitis vaccine.
Hepatitis and BCG was given to the baby. Do you have the vaccination card with you?
Yeah, and
Okay. I will just recommend to complete the vaccines to the
Yeah.
babies. It's very important. So then you have completed the vaccination course also. Now we will proceed with the next step, growth and development. In the growth and development, I will ask like, do you find any abnormal movements in the baby, like
No.
abnormal movements of the legs or anything? Okay. Can you tell me about the like he able to grasp properly
Yeah.
when you give the finger or anything?
Yeah.
Does the baby is active or like
He is active because he is responding to the actions.
he is responding to the actions like smiling and all?
Yeah.
Everything. Can he able to follow the actions like
Yeah.
some actions?
Now.
Okay.
Some
So
actions.
that means it's good. So now we'll proceed with the family history. In the family history, can you tell me like does anyone have the problems like diabetic or stomach?
No.
No one has. Can you tell me about the problem like hypothyroidism?
No.
Family history, no. Or any problems related like sexually transmitted diseases?
No.
No problems related to like that. Or any cancer history in your family?
No.
No cancer history. We'll proceed with the personal and social history. Can you tell me about like personal and social history? Where do you live?
Casa Lisa building, the city.
Kasarila, Dawar city. And can you tell me like with whom do you live? Like grandparents are there or not?
Grandparents.
Grandparents are there. Then what is the source of water which coming
It's
through
like Dawa municipality.
the municipality? Like what is your qualification?
I'm doing job in teachers.
How about your husband? He's also doing job.
Yeah, he's also doing job.
Okay, that means good. Means you have a nice source of income in your family also. How about the waste disposal? Like every day you will throw the
Every day
waste?
morning we have to in the full garbage.
Okay. So after the personal and social history, we have the review of systems. So can you tell me about the review of system? Like, do you notice any signs of difficulties in the breathing or anything?
No.
No difficulties of
No.
breathing or anything you noted. Can you tell me about the problems related to the vision or anything you noted, like discharge to the eyes or any problems
No, I won't notice anything.
you didn't notice?
No.
Or any problems related to the cardiovascular system?
No problems.
No problems were noted. About the musculoskeletal, like he can't able to move the.
No, he
Like
able to
hypothermia.
lay that hands.
Okay. And can you tell me about the digestive system problems? Like, does he able to pass his bowels properly?
Yeah.
There were no problems in
No
the
problem.
passing the bowls. Okay. And urinary, like, does he able to pass his urine properly?
Yeah.
You didn't notice any abnormalities?
No ordinary.
No abnormalities were noted. Okay. So I will just summarize the details. We are done with the examination, and as the John is 23 days ready, and there are no abnormal findings there in the examination. Like I asked about the birth history. The birth history of like normal vaginal delivery, no complications were done. There is no history of you didn't. I forgot to ask about the ask about the hospitalization and surgeries. There were no surgeries
No
were done,
surgeries.
right? And hospitalizations
No.
were also not there. So you told me about the immunizations. You gave Hep B and BCG vaccines to the baby, and you have the cards, so you proceed with the next immunizations also. Then you told me about the good nutrition and feeding also. Like you are doing breast. Just do the breastfeeding up to 6 months. After that, you can try to give the complementary foods. And then I asked about the family, personal history, everything. You are living with the parents and like a happy family, so there are no abnormalities in that also. And you don't have any problems like familial diseases or anything. These are abnormalities. And the baby also in the rehab system, I can't able to find any abnormal findings like while passing the bowel there any abnormalities or any headache or anything. So you are done with this examination. Do you want to add anything in this examination?
No.
No? Okay, thank you.